Martinez, who comes from the Department of Public and Human Services in Texas, Dallas. You wait. Yes, thank you all so much for having me here today. Thank you. Thank you, Armando. We also have Doctora Mayra Nieves-Rios from Barrios, Unidos in West Dallas. Doctor. Hello, everybody. Thank you for having me here, and I hope I'm able to answer the question.
Y también tenemos con nosotros
Thank you, Doctor. We also have Blanca Garcia, mental health professional with Grand California Foundation. Thank you for being here with us today. Thank you. Thank you for the invitation. Thank you. So we're going to go ahead and start with you, Mr. Longoria. Thank you so much for being here today. We have a few questions about, before we start, we want to invite or let you all know in English. Those of you who want to hear this town hall in English, please press the button. Is it the same option on the right-hand corner? Yes. But anyway, we're going to go ahead and get started. Okay, Mr. Longoria, can you let us, would you be able to give us a brief summary of the impact that COVID-19 has had on our state? And, what is the committee about? Of course, and thank you all so much for being here. I think it's really important, especially for the Latina community. So, and I'm sorry, I'm currently on the road and I want the video to look well. So that's why I'm not on camera right now. But my name is Oscar Longoria. I represent District 35. Right now it's going to be my 10th year actually at the Capitol. I've served 4 terms at the Appropriations Committee. I have 2 terms as the vice chair for the committee. This committee is about the funds for the entire state. How are funds going to be designated? Part of it goes to schools, to health, expansion of roads and streets, everything, everything that you think about, how to govern a state and how we spend that. So it's a very important committee. It is something very important. At every session, we have a couple of laws that get passed, and House Bill or Senate Bill 1, it needs to be passed every time where we have, that tells us how we're going to manage the state Texas budget. That's how we know how we're going to pay our teachers, and that's how we're going to pay people who work in health or in roads, and it's just for the whole state. So it's something that's really important. So with the pandemic that we have going on right now, we're going to have a really negative impact in this upcoming session. Right now, what we see is we have $4.6 million less for the state when it comes to, the state budgetary needs right now. And so when we start session in January, we're going to start the budget process for year 2022. 2023. Right now, we're in the current cycle that ends at the end of 2021. Because of what's happening with this pandemic, we see that we're going to have to find another $4.6 million to be able to fulfill the needs that we have in the state of Texas. I'm sorry. So it's kind of like if somebody had their home and their own funds to manage and pay their home, right? Let's say if we have this house and we're in negative in our accounts. Exactly. It's like right now you're making your payments and then they come and tell you, you know what, you don't have enough funds to pay for these obligations. So it's something really important. And now, thank God, the state of Texas has something that a lot of states don't have, which is a rainy day fund, which is an account that we have essentially where we have funds that we don't touch, but in an emergency, we're able to use those without having to depend so strongly on just the economy. Right now, it has about $7 million. I hope that we're able to really use those funds to pay the debts we have in our budget right now due to the pandemic, this pandemic. But in the future, soon we're going to see, because of how the economy is running and, how tax income is going and how the world is moving generally, especially the state of Texas, there's going to be a need to make negative adjustments. I don't I'm not expecting to have the same funds that we were hoping to have because of the pandemic. We weren't expecting something like this. Is there something that we as representatives able to do something to take care of the state of our health? Of course, yes. We need to make sure that we look at, you know, incomes that we don't have right now. You know, maybe the, you know, expansion for gaming centers and sports. You know, there are things that maybe shouldn't be applied right now, you know, and we need to look at where we can get funds from, because you know, we want to, what's most expensive for the state, where we spend most money, is in health and in education. So if we don't have enough funds, then those are the first places where we go look at to try to move funds around. And it's something that can have a really negative effect, because those are two very important areas that we don't want to make, where we don't want to make any cuts. It's a really important aspect of our state. And this is something that we haven't had in the past. Okay, and honestly, we're going to have to be really creative, because you talked about health and education, where we would really be affected. And I'm guessing it would affect Latinos more, you know, because most of the students in public schools in Texas are Hispanic, right? Of course. And I am a product of our public schools, and they are very important. And a lot of people who are Latinos are going to see themselves very affected by this lack of funds. Right now, we have a global pandemic going on with our health. A lot of people are in the hospital, and there are going to be a lot of expenses in that aspect as well. So we need to really prepare ourselves to be able to invest in these people, so that, you know, they can continue to get better and to work and give back to the community. But I understand that if we don't take a look at these expenditures a lot more closely, it's really going to affect the health of Hispanics and Texans. Okay, so another question, Mr. Longoria. We've heard a lot about the census and the needs, and, you know, we've been told and we've heard how important it is to fill out that application or the survey to count our families. How is the federal census, you know, connected to the federal national census? How does that connect to Texas? Would that help the Texas economy? Yes, of course. You know, more than $675 million federal dollars are divided based off of population around the United States. So if we don't really do well with the census, you know, the state of Texas could lose hundreds of millions of dollars, and that would be for the next 10 years. So it's really important, and there's a lot of urgency right now, especially because of the pandemic. A lot of people don't want to go out. They don't want to do, you know, the things that they need to get done. And we need to do all that we can do for the census, because it is something that is going to affect us for the following years. And so please, I ask you all to spread the word and tell people this is something really important that we need to do on behalf of Texas and the population here in Texas. So to prepare for our future generation of families and children in Texas, it's not only to participate if we're able to vote, but also to fill out the census. Is that right? Of course, it is very important to vote, and especially to fill out the census as well. It has such a great impact on the state. It happens only every 10 years, and it's going on now. And we're doing this differently to how we've done it in the past, you know, where we've been able to go knock door to door, but we don't have access to that because of the pandemic this year. So please spread the word, make sure everybody registers on the census, especially the population of people who are Latinos. You know, we think about immigration and how it may affect us, but no, it will not affect your immigration status. And just please, I recommend you all to do it for the kids, for the families, and for all of the people that live in the state, because we need to receive the funds that the state of Texas is meant to receive. You know, it'll be beneficial for everybody, especially for people who are Latinos, because they're filling out the census. Of course, Mr. Longoria, thank you so much. We appreciate your support, you know, make sure that we get these things done to improve and help the population here. Of course. And you have a representative that's really, really good, that is doing such beautiful things for the community, and is explaining everything that's happening in Spanish, everything that's happening in the States. So thank you so much. Of course. Have a good night. Likewise. Thank you. All right. Well, now we're going to go ahead and continue with Mr. Armando Martinez from the Health and Public Services Department here in Dallas. Hello, Mr. Martinez. Hello, good afternoon.
En este foro,
everybody. Before anything else, thank you so much for having me here on this Latino forum. And I just want to say, we Latinos, we're ready, and there are a lot of things that are happening. My name is Armando Martinez. I'm a community liaison for the Department of Health and Human Services. Thank you for having me today on this afternoon. Thank you, Mr. Armando. Armando, can you give us some stats about, what do COVID-19 cases look like right now in Dallas, Garden, Wichita, and Addison, and, which are a part of our district? How is that affecting us, specifically in this area? Of course, we actually just received the statistics from September 15th, which was just a few days ago. And the South District has several cases. Garland has reported 6,907 cases. We also have another 3,015 cases, and then the city of Richardson has 1,234 cases that have been reported in that district. Wow. And the city of Dallas in total, do you have that data for the city of Dallas? For the city of Dallas, I don't have that data with me, but of course, it would be a pleasure to go ahead and send that over to you all. Thank you. And what does this data tell us, about our district versus other counties in? Well, you actually have a lower percentage of contact with positive cases compared to other areas in Dallas. For example, Garland has a moderate percentage of positive cases of COVID-19. Why? And that's because Garland is close to the borders and limitations, close to the city of Dallas and Mesquite. So that's why their percentage is a little bit higher. But Garland, in reality, it's a city with the third highest number of cases, and then it's Dallas, and then it's urban. So, and this is actually because we see a larger amount of contact within larger cities. And this is because there's a larger population and there are more people that have to interact amongst themselves. And this leads to a higher transmission of COVID-19. Of course, and I imagine it also affects a lot of families that have several generations living within the same household, correct? Exactly. And does the county have information about positive cases divided by race? We don't have that information. The county does not divide the amount of cases by race. And I'll tell you why. Because people are not obligated to provide that information when they get tested for COVID-19. Therefore, we're limited to asking for that information, and that people don't have to reveal that information, their racial information. But we do have information about, the deaths and fatalities within hospitals, and we do have that categorized by race as well. You can obtain this information off of our website. If you can go to www.dallascounty.org, right there where it says Dallas, it says COVID-19. You can also go in there and take a look at the reports that we send out every Tuesday and every Friday. So as I said before, these data have come out since the 15th of September, and I have the amount of deaths. I'm going to present that today, but we're talking about the white race, people who identify as white. They have 27% of all deaths due to COVID-19. Talking about Hispanic, there's 448 deaths, which is 46% of all deaths due to COVID-19. And speaking about African Americans, there's 333 cases that have led to death, which is 44% of all deaths. And if we go to Asian, people who identify as Asian, there's a 30%. So almost that half are Hispanic. Half of reported deaths are Hispanic. Correct. And it looks like there could be more deaths than what is reported in our data. Correct. Those cases that still have not been reported or that we still don't know about. And then that's really important because these state numbers reflect today, right? We have more than 14,000 people who have died in the state of Texas. And I imagine as well that the majority or many of those are Hispanic families. Okay, we're gonna go ahead and talk to the doctor and Miss Blanca as well to see how what we can do for our families. But you know, at your job, what is something that's surprised you the most? You take record of all these numbers every day. So what has surprised you the most about the Hispanic culture, and what has affected us the most in causing us to be the largest portion of these numbers? Of course, as you said, Ms. Ramos, the Hispanic and African American community have been the most affected by, you know, disproportionately because of COVID-19. Even, you know, even throughout the entire United States and still here in Dallas, you know, the data related to COVID-19 shows us that those are the folks that are dying due to COVID-19, which is a higher percentage than, you know, than Hispanics, right? For Hispanics are 41% of the population in the state of Dallas, but listen, they represent 46% of the deaths by COVID-19. And yes, you know, if the community, the Hispanic or Latina community have been most affected by COVID-19. And you know why? Because this is what we believe. We believe that this is happening for several reasons. First and foremost, it is more likely that essential workers are not able, it is more likely that Latinos are the first essential workers, you know, at the forefront of this, which means that we show up to work, and no matter what the situation is, we're people who are ready to fight at the forefront. And the second reason is because there are essential workers who cannot, you know, work virtually, which means that they're not able to work from home, or because they don't have those resources, or because they don't have paid sick time. They just simply don't have access to that sometimes. And that's why the Hispanic community is seeing this at higher rates. It is also more likely that they'll be more exposed to the virus, right? They show up to work, and you know, they're interacting with more people, and the likelihood of transmission is higher. And we're Latinos. We like to be with family. We like to be with people. And that means that we have extended family members that are living in the same household, which means that in reality, if there's one person that has been infected, you know, we have to be together. We're not able to be alone in isolation or in quarantine, and that's also affecting us a lot. Why? Because we've seen that COVID-19 is affecting families that are Latinos, and it's really due to the close space living within the Hispanic community. Yes, and as Mr. Longoria mentioned, you know, he talked about the funds, where we apply most funds in the state of Texas, not only in education, but also in health services, you know, health services, let's say like insurance or coverage for our families, right? So we hope that, you know, the Democratic control, the Democrats are able to take control this next year, so that we can continue supporting our families in case they have days like when they don't feel well or they're sick and they still have to go to work, you know, because it doesn't help anyone if you go to work and you don't want to report it to your boss. You come home, you get your entire family sick, and there's no insurance. Then the situation just gets even more severe, not only for that family, but for the extended family members as well. So we need to do our part. We need to fight, and we need to vote if we're able to vote, and support our families and our kids. Thank you so much, Mr. Armando Martinez, for being here today and giving us this very important information. And what is the website where we can find that information once again? you can go to www.
Y cuando entra a la página,
douglascounty.org, and whenever you go to the website, there's a tab that says COVID-19. You can click on it, and you have all of the information about COVID-19 or coronavirus.
también
And you're also able to go to register yourself to find more information about statistics, and all of that information is there. Thank you very much. Thank you. Thank you. Now we're going to continue, Doctora Mayra Nieves-Rios, Doctora Clínica Barrios Unidos. Doctor? Dr. Nieves? Oh, thank you. Yes, good afternoon, everyone. Thank you so much for the invitation, Ms. Ramos. Of course. Doctor, could you tell us what are the symptoms of COVID-19? Of course, we've talked a lot about COVID-19, right? And people are so familiarized at this point that this will be more of an overview. But the symptoms of the illness are several, you know, and the main ones are fever, chills, dry cough, difficulty breathing, fatigue, body aches, headache, recent loss of sense of smell, throat pain, congestion, and mucus, diarrhea. Basically, those are the symptoms that patients who have COVID-19 present. Is it true that someone can have no symptoms yet still have the virus and have that in their body? Actually, about 40% of patients do not have any symptoms. 40%? We estimate that close to 40%, yes.
Yeah.
And that's a lot, that's a lot. And that's why, you know, that makes it so difficult, right? The fact that we're able to feel well and still be a carrier of the virus. That's why we need to be very, very cautious. So what are the precautions that we're able to take to protect ourselves and families from coronavirus? In general, make sure you protect yourself from germs, but now especially COVID-19. In order to prevent transmitting this disease, we need to make sure we keep 10 feet of distance between ourselves and others. We must cover our nose and our mouth through a facial covering like a mask, especially when we're in public places as well. If we don't have something to cover our face, use the inside of your elbow to cover your sneezes. Avoid touching your face when we have symptoms and whenever you're wearing your facial covering or mask. We need to clean commonly touched surfaces such as door handles, countertops, restrooms, etc. The point is common use areas. And also stay home if you're sick and wash your hands frequently. Make sure you use a really good system of washing your hands for 20 seconds, however many times that is necessary. And let's say families are going to send their kids to school. Is there something specific that they should do before or when kids come back home after school? You know, if kids are going to be going to school in person, is it required that they also use a facial covering or a mask? And also, is there anything else that families should do with those students when they come back home? Ideally, as soon as they come back home, they should take off their clothes, take off their mask, put it in the dirty laundry so that it gets washed, because you should wash it daily. And, you know, if you have if it's easy to do this quickly, take a shower. And what should kids do with their backpacks, or if they have books? I don't know if they'll be sent back home with books, but what should they do with their backpacks or items that they bring home from school? Clean the surface. That would be considered as one of the commonly used surfaces that should be cleaned down frequently. Okay, and you know, we've spoken a lot about the flu vaccine. Would it help us in this case to get the flu vaccine at CVS or at our doctors? would that help us combat or fight against coronavirus? Or how does the flu vaccine, it's been called the twindemic, right? Two pandemics at once. Is that something important?
Extremadamente importante.
It is extremely important that all of those who are able to get their flu vaccine do it as soon as possible. We see what's happening with a new organism, which is COVID-19, and we're hoping to find a vaccine, but we're hoping that what they passed in 1998 with the Spanish flu is kind of what's happening now. It was a new illness, they found a vaccine, and now this vaccine exists today, and the vast majority of our population is vaccinated. They have that vaccine, and the impact of that illness is not as strong. But now with this with all these new things that are going on, people are being exposed to COVID, and we don't have the vaccine. So everyone should be as careful as possible. But in conclusion, everybody should have the flu vaccine. Thank you. And as a last question, as Latinos, we all love to get together with our families. And as Mr. Martinez was sharing, these might be reasons why many of us are finding ourselves transmitting or getting the virus. So when we want to hang out with our families, would it be ideal to get together outside of our homes, such as at a park where we can be more distance? Is that better or different from being indoors or in your patio or a park? Is that different? Definitely. The indoor environments within a building does not allow air to circulate as well, and the virus fabric stays within the air, and one is exposed at a higher risk. So the more we can, the more we're able to perform our activities outdoors at a park and distance ourselves from others, that would be ideal. One completely recommended. Thank you. Thank you so much, Doctor, for being with us today. Thank you for all of the information, and keep fighting for us within your, at the front lines and at the clinic as well. Thank you. Yes, and I would like to second the words that somebody else shared. Who was it? Mr. Armando Martinez. The Hispanic population has been extremely affected by this. And part of that has to do with, African American and Hispanic folks tend to have more chronic illnesses or chronic diseases that get worsened. The quality of medical services that we have in this country, a lot of Hispanic folks don't have access to that. A lot of people are not able to have access to vacation time or paid time off, and that also makes them more susceptible. And these are all factors that make that causes the Hispanic and African American communities to be more exposed at a higher risk. And but yeah, that's important. Thank you so much. Thank you for being here. Have a good afternoon, doctora or doctor. Perfect. We're going to continue with Blanca Garcia, mental health professional. We've been practicing social distancing throughout the majority of the year. What are some tips that you have for our families as to how to manage stress within the home if we're not able to leave? Oh yeah, I don't know about you all, but it seems like, it's like month after month after month, and stress levels just keep increasing little by little. So it's really important to try to do different things at home. For example, having a routine. When you're at home all day, or your kids are at home all day, or your partner, sometimes time just escapes us. So we need to have a routine where we wake up at the same time every day, try to go to bed at the same time every day. And that is going to help us make sure that, we're also taking care of our nutrition and our meals throughout the day. You eat breakfast at a certain time, lunch and dinner, but use a schedule that works for your family. of course, we all have very different schedules. And, as Armando had said, it depends on where you work or if we are working or if we can stay home. Keep that in mind, whatever works for your family. But you should try to have a routine day after day. Right now, we're in a moment within this pandemic where there are a lot of changes and there are a lot of things that we still don't know. So the habits and daily routines really help with that. We know when we're going to wake up, eat, all of that. And the other thing that I also recommend for families is that whenever we're stressed out, we have, where our nerves going. And so please try to not drink a lot of soda and a lot of caffeine. The only thing this does is just makes us think even more, and we start rushing, our heart starts racing more, and it makes us more nervous. So I know I love my little coffee in the morning, but we should try to cut back whenever we can. So maybe 1 cup of coffee instead of 4, maybe 1 soda instead of 4, whatever works for us. And I would also like to recommend something that honestly has helped me a lot, and I've been able to talk to my coworkers with this. Try something new. Everybody says, oh, exercise, go outdoors. Yes, but there are so many other things that you haven't done before. My dad, who's older in age, he's 70 years old, and we decided to do yoga. We did it twice. We were gonna supposedly do it for 30 days. It was gonna be a 30-day challenge. We did it for 2 days, but you know what? On those 2 days, we were just having laugh attacks, having fun, just trying something new. So that was a new connection to support each other. And maybe we could have tried something else. So try something new with your family members or your kids. I promise you that kids know how to use YouTube. They know how to use the internet. So tell them, hey, find me a video for this type of dance or this exercise or whatever challenge you want to take on, and do it together. Yeah, there's a lot of dance classes, right? We post our cumbia videos and we're dancing as well. Something that my family has done a lot, are puzzles. It is something new for us. We take hours with this puzzle, but the kids also participate. And I imagine that would help the kids mentally as well, right? Of course, something really positive about our culture is that we focus on family. We have that family support. So whenever we're all home, we're going to take advantage of that and have that company, we're going to listen, to learn, cook, dance together. If your child likes, let's say, the flute, okay, if one day kids like flautas, a type of food, okay, well, let's do it that day. But mom and dad aren't going to cook. We're going to teach our kids so that at the same time we're spending a joyous time together, So we have things that we like as Latinos, and we're going to do it and enjoy it together. Of course, and one of my favorite memories was when I would make tortillas with my daughter. She was like 3 years old, and I'd give her the roll pin, and, she'd make her little tiny tortillas. And these are beautiful memories. So now is the time to create those type of memories with our kids and help them remember, help them have like an escape, Right, just a change of focus. Instead of always focusing on all of the negativity that's going on, yes, we do need to acknowledge it and take precautions. And at the same time, find ways to continue to enjoy things on a daily basis. With our kids, of course. And is there something specific or something that particularly we can involve kids, like different activities or different conversations, books, any resources that we can direct our families to so that they're able to help the kids? So what I would really recommend during these times in which we're cooking together, eating together, exercising together, take that time to talk. Start that conversation. How do you feel? How are your friends doing? How are you getting along with your siblings? To see how they feel emotionally. And we can set that example. We can say, Oh, you know what? Yesterday I had a really difficult day. I was really tired and I struggled to focus at work. How have you felt? You know, just ask our family members, how are they feeling? Because we also have to vent. You know, we have to express ourselves verbally. We need to talk about it. I know that a lot of us families are struggling with virtual classes. They are offering support through schools. I know that right now it's a little more difficult. We might not be able to go in person, but we can call, we can try to send emails. The applications, the apps that are being used to join their classes or participate in them, you can send messages on there or ask your teacher for help through that, or maybe the school counselor. So I don't want you to think that counselors and social workers are no longer available. They are there. It's just a different method of communication. They're able to give you, different resources, like medical services, if that's what you need. If you need assistance in finding resources for mental health, that as well. Activities. Maybe the family is new. Maybe you just got to Dallas, to this area. You've been here for just a few months. We haven't gotten out. Well, ask ideas. Where are there parks? Where are spaces where are some spaces that we can enjoy as a family? Use the resources at your school. Make sure that, if your son or your daughter, your children if they have a pediatrician, they also have resources, and as we also recommend having mental health support. As a mental health professional, I want to make sure everyone has support. So I have a phone number that I'm going to go ahead and make sure that when we post this video, the information is available. We can also post that on our website, Texas Web Ramos. We can go ahead and put it on our website with all of the resources from Ms. Garcia. Yes, exactly. And just so that all you families know, I don't want my Hispanic families to suffer in silence. Many times we don't talk about mental health, or, hey, just think positively. Why are you so lazy? Get it together. These are really common. And none of us have ever gone through a pandemic, first of all. We don't know what to expect. We don't know how we're going to feel. And, we have stress after stress after stress. So it's very normal for one to not know how to maintain yourself well, right? We're going to be more frustrated or more angry or moody, and we have to find mental health services to support us. So I really want to ask you that if you need to talk to anybody, you need to just vent, and you're just sick of everybody who's in your house, call one of those phone numbers that we're going to post on here as a resource, and so that you're able to take care of yourself and be able to have that time for yourself, because I know it's really difficult to do that when we're all at home. Yes, especially myself, and I imagine you all as well, as a Latina parent who has to take care of everything at work, take care of any issues with our husband and with our families, and all of that is very stressful for us, and it is normal. For me, when I'm in that mental space, I turn the music on really, really loudly, and my family knows, to maintain distance until I'm able to relax myself. For me, exercise is really important. I have to go out for a walk. I've heard people in our community say that they even go for a walk at the cemetery where they know that a lot of people aren't going to be there. So these are things that are like mediation for them, for their mental health. So, but to read is also really important. Now is a time. Before, we were running up and down and going everywhere, but now is the ideal moment, if there's an ideal moment, to read, to learn how to speak English, or learn a few words, or learn about what's happening in this country and in different countries. this is an opportunity for all of us to improve intellectually as well, so that we're able to help our families and our kids. But it can also be something, like a novel for, to get away from reality, and just read a book from, I don't know, some famous author, or a good story where we can turn off the TV and escape into a book. I imagine that would also be great. Yes, and these can be a part of the routines that I mentioned before. As a part of your routine, 30 minutes a day, you turn off all electronics. Everybody has a book or a magazine, maybe a notebook to write something down or draw. Just take this time that you have out at home. If there are a lot of people at home, many times you don't have a lot of time to yourself, so that could be a really great recommendation. Thank you so much, and thank you to all of our guests. Thank you to Blanca, Dr. Mayra, Debbie, Lawrence, Armando, everybody. Thank you so much for being here. Sorry for what happened at the beginning before starting our town hall today, but thank you all for continuing to be here, fighting for your jobs, your families, for our community. We're going to keep working strongly at the Capitol so that we have strong years to come. So remember, if it is possible to get the flu vaccine as well, to protect our families, try to escape mentally in whatever way is best for you, through meditation, reading, going to the park, exercising. But we're going to come through this. We're going to move forward all together, and we're all here united, and we're going to move forward. We just have to keep fighting the way that we Latinos know how to do it. So thank you all so much for being here with us today. I hope you have a really great afternoon. It's been a pleasure. Thank you. Bye-bye. Thank you.